Hey guys, this is Dr. Hub. Today we'll look at the obstetric forceps. So as we proceed, we'll look at the diagram of the obstetric forceps. So there is something known as toe. So this is toe, and there is the presence of the cephalic curve. This will be the cephalic curve. Then there is a presence of the heel. Okay, so this is nothing but the heel, and then comes the presence of the shank. Next, there is presence of something known as the lock. So this is nothing but the presence of the lock, and there are some projections here. This is known as the finger lock. Then comes the presence of the handle. This will be the handle. Now let's look at some commonly used forceps. So we're looking at Simpson's forceps. So in terms of Simpson's forceps, how does the appearance look? So Simpson's forceps, this is how the appearance looks. So it is U-shaped above the handle. So this is the rough diagram of the Simpson's forceps. So in the Simpson's forceps, it is the most commonly used type of forceps in outlet delivery. So in terms of it's most common in terms of the outlet delivery. And it has a elongated cephalic curve. It has a elongated cephalic curve, and they are used when there is a substantial molding of the fetal head. So in terms of substantial molding of fetal head. Next, we'll move on to the Elliott forceps. So this is Elliott forceps. So how does the diagram look? It is similar to that of the Simpson's forceps, but here there is no U-shaped above the handle. So this Elliott forceps, it has an adjustable pin. It has an adjustable pin for regulating the lateral pressure on the handles. And there is also, they are used most often when there is a minimal molding. So it is used in case of the minimal molding, and it is more suitable for the outlet delivery. It is for outlet delivery. Next, we will look at the Killand forceps. So how is the appearance? It looks like a straight handle, and it diverges at the end. So in terms of the Killand forceps, it has a small pelvic curve and a sliding lock. So sliding lock will be present. So small pelvic curve. So small pelvic curve is present, and there is a sliding lock. Sliding lock. The most common forceps used for the rotational delivery. So it is most common in terms of rotational delivery. and it helps to correct the asynclitism. So for correcting the asynclitism. Next we'll look at the Piper forceps. So in terms of Piper forceps, how does it look? So this is how the Piper forceps looks. So they have a distinct perineal curve. So they have a distinct perineal curve, and it allows application to the after coming of the head in breech presentation. So it allows for the application to the after, so allows for the application to the after coming of the head. So to the after coming of the head, and this is in terms of the breech delivery. In terms of the breech delivery. Next we look at the Tucker-McLean forceps. So how does the Tucker-McLean forceps looks? So it looks epic. So it is suitable for the fetal head with little molding. So in terms of little molding, and it is used in terms of the rotational delivery. In terms of the rotational delivery. Next is the Barton forceps. Barton forceps and the traction handle. So how is the appearance? So there is a handle here. There is a base stand. Then comes the presence of the forceps. So this is the Barton's forceps with traction handle. So it is used for the rotational delivery. So it is for the rotational delivery, and it is most importantly used for the delivery of the occipitotransverse positions. So occipitotransverse positions in the platypelloid pelvis. In terms of the platypelloid pelvis, and it is an obsolete procedure.